If you keep your work life separate from your private life, the last thing that you want to do is think that your boss is going to see you naked from the waist up. That's a hard pill to swallow. I'm Jamie Phelps. I'm an athletic trainer, and I was a clinical assistant here. I had a very long history of right shoulder instability. I got to the point where I couldn't throw a ball.
And finally, one day I just looked at her and said, Jamie, I'm stuck. We work side by side all the time. As you know, we're at the end of the rope. And immediately I could sense this anxiety that came over her. And you see that all the time with patients in the office. She came up with a plan. She showed up with a 6-inch ACE wrap, this elastic bandage, and she went around and around and around her torso a whole bunch of times. We positioned her, we did the surgery, she went home with it on the whole, we were able to prep and drape all around it. And I was like, wow, that's not something I thought was as doable as that was. We should explore that further. And it has to be durable enough that it can stay on when the drapes are removed and stay in place. And then certainly when we put the sling on the abduction pillow, it can't interfere with that. And then it has to be able to cover the patient so that it can go home with them and not only cover them but support them through the whole process until you decide to take it off.
I think that when people sign up for surgery, I think that they might not necessarily think about that until the day of, when they're getting into the gown and things like that. But I think it would be something that would ease their mind knowing it was an option.